Good morning. I'm Sanne Magnan. I'm co-chair of the Roundtable on Population Health Improvement of the National Academies, and I'm a senior fellow at HealthPartnersInstitute. So welcome to today's workshop in Washington, D.C., and/or on the web, since it's being a recorded webcast, of Models for Population Health Improvement by Healthcare Systems and Partners, Tensions and Promise on the Path Upstream. Since 2013, the Roundtable on Population Health Improvement has been providing a trusted venue for leaders in the public and private sectors to meet and discuss the tensions, as well as leverage points and opportunities arising from changes in the social and political environment for achieving population health. The Roundtable's vision is a strong, healthful, and productive society which cultivates equal opportunity and human capital. This vision rests on the recognition that the outcomes such as improved life expectancy and healthcare quality and quality of life for all is shaped by interdependent economic, political, and social environments, and will require dependable and generous resources for this vision to be achieved. Today's topic pertains to the efforts that are proliferating across the country to address non-medical but health-related social needs of people and the social determinants of health more broadly. There are two somewhat related activities in the Health and Medicine Division of the National Academies. One is the April 2019 workshop, Investing in Interventions that Address the Non-Medical Health-Related Social Needs, which has yielded a workshop proceedings, which can be found in your electronic packet. Next week, the consensus report, Integrating Social Care into the Delivery of Healthcare, will be released, and the link to sign up for this webinar is also in your electronic packet. One of our speakers today will share a glimpse of a helpful framework provided in that upcoming consensus report. The focus of our workshop today is how these emerging efforts continue to push upstream and not drift back downstream into only clinic-based interventions. How can healthcare play an important but appropriate role in addressing health-related social needs and social determinants of health? Particularly, how can we be humble and listen to the wisdom of community partners? Fears have been expressed by Lance and others that we should not medicalize the social determinants of health and/or population health. And in this rapidly evolving healthcare landscape, terms can be, quote, misunderstood, conflated, or confused, end quote, as noted by Aldrich and Gottlieb in their Milbank perspective. So how do we approach this topic? With open eyes and open ears and probably open hearts. For example, building relationships and capacity with community partners outside of healthcare, ones that can help us calibrate our efforts appropriately. These concerns, however, should not keep us from exploring what roles healthcare can play. Yes, the science for the roles of healthcare is nascent, so we should be cognizant of the controversies, such as described in a recent JAMA article, Screening for Social Determinants of Health, the Known and the Unknown. We hope today's workshop will add to the field, discussing the tensions and the promise of healthcare on the path upstream to engage with others in developing our roles. Today's workshop was organized by a planning committee: Mark Gurevich, NYU Langone Health, Sally Kraft, Dartmouth Hitchcock, Rahul Rajkumar at Blue Cross and Blue Shield of North Carolina, myself, Lourdes Rodriguez, University of Texas at Austin, Jeff Levy, George Washington University, and Philip Alberti at Association of American Medical Colleges, supported by National Academy staff members Alina Bachu, Carla Alvarado, and Brittany Davenport. The video and other meetings materials from this event will be made available after the workshop. A publication based on today's event will be prepared by an independent rapporteur, undergoing external peer review and be released to the public. If you are tweeting, please use the hashtag PopHealthRT. And if you go to a microphone to speak during the discussions, please share your name and your affiliation. If you're on the web, you can email your questions to Alina Bachu. I believe Alina's web address is right there on the page. Finally, we want this workshop to be a safe place where we can discuss the tensions and the promise in this work. In doing so, we can improve our ability to meet the needs of our patients and communities. We look forward to what we can learn together.